Let's talk about boxers and plastic surgery. What is your first association when you hear boxers and a plastic surgeon? Of course, rhinoplasty, and most of the time it would be secondary rhinoplasty. There are two aspects we're gonna talk about: aesthetic and functional. The reason they get secondary rhinoplasty is because the trauma they got during their job. Okay, let's bring up a couple of professionals in boxing. The first would be Devin Haney, second Saúl Álvarez, and Ryan Garcia. Believe it or not, but they all are clients of plastic surgery. Let's talk why do they have rhinoplasty. Now, there are two aspects: the functional and aesthetic. Aesthetic is pretty obvious because they constantly get trauma doing their job. But secondary reason they do rhinoplasty would be the breathing problem. The cartilage inside your nose, constantly traumatized during the boxing session, brings to the point they cannot breathe easily. The reason they do rhinoplasty would be to straighten the position of the cartilage inside their nose so they can easily breathe with their noses. What will happen if they won't do rhinoplasty? First of all, they start breathing with their mouth. That brings to lack of oxygen they consume, especially during the nighttime sleep. What does it cause? Fatigue, mood swings, headaches, overall bad feeling in their body. So this rhinoplasty would be a necessary procedure, not just aesthetically speaking. Okay, let's talk about other procedures that are essential for boxers. Don't forget, it's a constant trauma. And why do you think they look gorgeous on camera? It's not because they're natural beauty, it's because of the work of plastic surgeons and cosmetologists. It's not only rhinoplasty, that would be the constant work of cranial facial surgeons, because the broken cheekbones, the broken jaws, the broken cartilages in their noses, it's a mess, and it all requires a constant maintenance. Also, don't forget, when the inner trauma is healing, it causes scars, and those scars may result in visual scars on their faces, hollows, bumps, irregularities on their cheekbones, on their foreheads, everywhere. So it's also working with the soft tissues, not only with the bones, with fillers, with polylactic acid, with bone substitution. There are lots and lots of treatments we use working with professional boxers.